I am Nancy Lim-Yee, Program Director at the Chinatown Child Development Center, a children's behavioral health clinic of the San Francisco Department of Public Health, and a member of the California Social Work Hall of Distinction Committee. Today is October 5th, 2013, and it is a privilege and honor to be speaking with Sai-Ling Chan-Sew, LCSW, on the occasion of her induction into the California Social Work Hall of Distinction. Sai-Ling retired 2 years ago as the Director of the Child, Youth, and Family System of Care at the San Francisco Department of Public Health's Community Behavioral Health Division after serving the City and County of San Francisco for 35 years. Welcome, Sai-Ling.
Hi, Nancy.
How did you become involved in the field of social work?
Well, I actually was born in China and grew up in Hong Kong. So I had some early lessons in terms of social injustice. Hong Kong is under the colony rule of Britain. So even though 10%, less than 10% of the population is British or European, 90% of the population is Asian, but everything is done in English. And all the tax revenue are actually shipped back to England. And I grew up in that, not knowing, of course, as a little kid, but you see other areas of injustice. Our family was not doing that well, so we attended a school in a ghetto, an elementary school in a ghetto. So when I actually get up in the morning to go to school, I have to walk by a couple of blocks of really kind of like, I don't know whether you're familiar with, there's a place called the Wall City within Kowloon where really all kinds of things happen, prostitution, crimes, drugs, you name it. So what I would see every morning is actually when I go to school, there's some girls actually would be actually, I can see them through a window where they're going to sleep. They're brushing their hair, they're in pajamas, and they're not much older than me. Maybe they're like 14, 15 years old. So I always wonder, what is happening? Why are our fates so differently? Why am I going to school and then why are these girls really kind of checking out from being the nice work and going to sleep at that time? Eventually, when I got older, I got involved in some student movements. So we were pretty active in terms of trying to get Chinese to be established as an official language, given that so many people speak the language, but it was never adopted. Right. And then I got involved with some of the change in terms of the increase in fare, in the ferry. At that time, I think it was really cheap. It's like 5 cents, but we went from 5 cents to 10 cents, and there's a lot of people who can't afford it even. So I have early education on injustice and the feeling that, well, I need to do something about it, and the need for social change. So when I went to school, I actually majored in psychology, and then I went into sociology, and then I decided, well, maybe social work is more, give me more of the tools that I need to do to actually actualize some social change.
So even very early on,
you
got interested in social work.
Exactly.
Yeah. And what was the field of social work like, and the political and social economic climate like when you started in this field?
It was kind of exciting, actually. In the 70s. That's during the time of the Vietnam War. There's the civil rights movement, there's the Rainbow Coalition. I mean, everything that is actually, seems like that all of a sudden the community and young people and not so young people are waking up to injustice. And there's a lot of actions taken to try to address that. So a lot of organization. And, as I was going to school here, I got involved in the anti-Vietnam kind of war, in some of the, campus kind of protests. But then when I left school, I came to San Francisco. I got a job in Chinatown, San Francisco, and really got inducted into a very exciting time of community development. That's when we first met, actually. There are very, very few agencies at that time, maybe, 5 or 6 agencies, very few services, clearly for the immigrants. And there's lots of immigrants in Chinatown at that time because there was a change in the immigration policy in the 60s, So lots of family members are coming, and then that's also around that time you start getting some refugees in the Southeast Asian countries. So lots of people who is new to this country, kind of like another wave of immigration for the United States, and the time is right for actually developing a much more robust service system for them. So we just go to work. I think we did some of the work together. We look at the need for mental health services. When we started, there's actually no service for children and families. There's one kid being served.
That's right.
By the whole city of the whole city of San Francisco.
I remember that subcommittee that did the study.
Yeah. So there's a city with 20% Chinese population, one kid from Commodore Stockton being served. So quite impossible. And we started this agency, the Chinatown Child Development Center, to provide more innovative way to serve the immigrants. And I still think it's actually very innovative even now, because instead of just saying, well, come for clinical services, we created a whole system of drop-in services for young children and the parents and the grandparents, and we created a whole family center where families can come and gather, and not necessarily just for mental health, but for whatever they need, and to actually also break the isolation from their home. So from there, it grew into a pretty robust clinical treatment program, and did a lot of good work for the community, and still going on right now. And from there, we actually it's like any community, you start seeing all the other needs. So we start working at addressing domestic violence. We work on the Asian Women's Shelter Project. We start to address childcare programs. So there's a lot of activism and a lot of possibilities, because there's also a lot of funding. The federal government has NIMH, CMH. There's a lot of federal support as well as local support for development. And it's a good time. It's a good time.
Right. And how do you think these areas have changed during the course of your experiences?
I think a lot we have come a long way. There's a lot more recognition and legitimization of the need for equality. So I think clearly civil rights has made great strides. There's improvement in civil rights. There's improvement in school integration. There's reading laws against discrimination. I mean, there's a lot more institutionalization of the need to treat people equally, equal rights. But I think, equal right doesn't mean equity. So in many ways, even though it's on the books, it seems to be everything is much better. And in fact, there's also more collaboration among public agencies, among private agencies. People are working closer together. But we're still a long way from actually being equitable. There's still a lot of discriminatory practice that's happening. I mean, we witnessed quite a few of it recently with the BART incident, with just racist comment, with the latest Miss American pageant. You were telling me about that. And it's just like, it never ends, and access still as difficult for many people, especially people with limited English capacity, but not only for them. For most ordinary people, when you go talk with them, we said we have this litany of services. I used to go to give talks, and then I said we have everything that the community need. But then, then inevitably someone in the audience would come up and say, I don't know how to get your service. I have this particular need, and it always fall through the crack. I mean, you may be able to offer service to me between Monday to Friday, 8:30 to 6 o'clock, but I work all those times, and I need someone to see me at 9 at night. I don't have any service, or someone who's monolingual may pick up the phone and call a central intake line, and they speak a language that the central intake line don't have, and they say, wait a minute, let me put you on hold. I'm going to call AT&T so you can see if you can get an interpreter for you. By the time you get an interpreter, the person on the other end may say, well, even though I had thought about killing myself, well, maybe not today. maybe I won't. It's just those kind of actual implementation of, the rights that people have is often got caught up in actualization, and it's difficult. So that's one thing, and the other thing is I think our total allocation, our total focus has shifted as a country. Since 9/11 and since the whole war and terrorism, there's a real sense of insecurity. That a lot of attention seems to really kind of turn from social activism or making this place a better place and creating a better caring kind of environment for each other, seems to shift to, well, I need to actually be more secure and more and safer and protect my family. So I actually, there's much more individualistic kind of approach. At least that's how I see it. How can I actually make sure that I'm safe and my family is safe? And then, a little bit less of the sense of the community.
Why do you think that change shifted? What caused that change?
Well, some of it I think has to do with really the really this attack on American soil of America. I mean, having 3,000 people died is not a small number. It's a lot of lives lost at a time that's we're least expecting it in some sense. It's such a shock to America.
It's so sudden.
It's so sudden, and it's a there's always a sense of security and growth and advancement. How America is always like, we're always inventing things, and we're always on the cutting edge, and we're always ahead of the curve for everybody in the world. But bam, this happened. And then it really kind of shakes, the core of security and safety and ability to take care of ourselves and protect ourselves. And there's a lot of national attention, and I think individual attention and community attention turn to, well, how can we actually make ourselves safer? And then, to make matters worse, then we had the bust of the economy, where people are suddenly, even middle-class families are losing their homes. People are losing their jobs. It's just like, it seems like that within a decade, we went from, being, on top of the world and ahead of the curve in everything to, boy, we can barely hold on to our seats and hold on the seats of our pants so that we can actually be, secure. And there's a lot of retreating into, just let's take care of ourselves, let's take care of us, and let's just be safe as we can be. And let's not take as much risk, and let's not look, even though if there's someone is lying on the street and being homeless in front of our door, let's not look. Let's not think about how we help them. So it's really kind of unhealthy. And I have to say that the whole technology explosion, the whole invention of technology somehow give people more of the tools to retreat. Because now you really can be very connected to everybody in the world through just sitting in front of your computer. You don't have to leave your home. You don't have to get out. You don't have to look face to face. And you don't have to actually trip over the person that's sleeping in your doorway, because you can be very popular and you can be doing great things, and yet not really addressing what needs to be addressed, and not actually talking to the person next door, right? So I think those things are all changed.
So during the years, 35 years of doing the work, there's been a lot of different changes.
A lot of changes. Plus, there's really much less resource devoted to human services and health services. Because if you actually look at the actual dollar spent and the percentage of the total budget spent on services, I don't think it has actually increased that much. And if you actually put it in terms of the actual dollar compared to cost of living, I think we have going backward in terms of what's available. So in some sense, I see that there's more needs but less resource to address it.
Well, can you provide a brief summary of the different positions that you've held over the years?
Well, I started as a line worker. I was actually a clinician, actually, and carry a caseload. I did, individual work. I did group work, and then I took on some clinical supervision, became a unit director, And soon afterwards, I became a director of the program, the position that you hold right now. And I did that for, 14, 15 years. And from there, I actually went on and become a system of care director for children and family for the City and County of San Francisco. And I did that for another 15 years or so. So during that time, I also did other work. So I taught at San Francisco State University for about 5 years in the grad school. I taught a couple of classes at UC Extension. I had a private practice for a number of years. I also raised a family. So I've been pretty
So you
busy.
did quite a bit.
Yeah, I've been pretty busy.
Yeah. And what was your main area, main focus in all of the work that you've done?
Women, children, families, and people from minority cultural backgrounds, coalition building, integration. I think I'm pretty good with connecting with people and connecting people to people. So I did a lot of system of care development, both in terms of public systems, helping people to talk to each other, helping people to see where we intersect, because it's so easy to pick up from the differences when you meet each other, and especially when you have big systems, mental health, child welfare, children probation, the police. When you talk to each other, it's so easy to go to the things that we don't agree on, and you don't really see a lot of things that you do agree on. So I think I did a lot of the coalition and bridge building among different partners, and also I also bridge really the somewhat of the divide between the private nonprofit service provider and the public sector. Because actually, prior to my going down to downtown to work in the central office, there's a civil service, and then there's a group of nonprofit provider, and they always treat it separately. They were actually even meeting separately. But when I got there, I had a different vision. I was really saying, well, we have such limited resources, and we all serve children and family. There's no need to meet separately. There's no need to actually separate our focus. We need to work together, and we need to really kind of figure out how we can put forth our best, from each of what we can contribute and create a more robust system. And that happened. So that's
That's wonderful.
Yeah.
And I think from my perspective, that was really one of your greatest contributions, is really to get your greatest asset, getting people together and working together.
And seeing
Right.
seeing beyond what they just need to do in the silo.
Sure. Yeah. So of all the positions that you have held, which did you find most gratifying?
I think they each actually have the joys, the moment of joys, and then the moment of frustration and challenges. But I think I enjoy people the most, and I think in each of my position, I really do enjoy the people that I interact with and that I work with. So starting with the family that I work with, the clients that I helped. And then the colleagues I have from Chinatown Child Development Center, the colleagues I have from the Department of Public Health. And I always actually learn so much from talking to different people, listening to them, and also felt that I always gained something from my interaction with each of them. And I felt that I become a better person every time, And in one instance is I can tell you that when I actually developed a system of care, one of the thing that I did was actually bringing consumer much closer to administration. So I got so much education from the young people that I work with, and they told me so much about, in many ways, the real world that I think I know, that I don't know, and it's very gratifying. So I think really the people interaction is really quite gratifying for me, and then I treasure them. Many of them become friends for life, like you.
Sure.
So,
And so, what kinds of obstacles did you encounter?
wow, it's loss and loss. I mean, I guess one place to start is actually the whole budget cycle, and the trying to really figure out how to maximize resources while meeting the target for reduction. I mean, it seems that as long as I can remember, I'm dealing with budget reduction. I mean, for like 30, 40 years,
Well,
every year.
I remember
Yes,
those days.
yes, every year there's, really kind of, inevitably there's some part of the program has to be kind of trimmed. So I think as a consequence, actually, I developed really good skill. I think what I have really learned is that I can influence the system. I can influence decisions no matter what position I hold. So I give you some example. When I was running the agency, in CCDC, when there's budget reduction, through the, ordinary channel, you really couldn't reverse the budget reduction decision. It's something that came from above, and you have to actually, comply and come up with a list of people that you want to trim. But I actually learned early on that you need to let your clients know what the impact would be in terms of the reduction. So if I have to lay off these 2 people that's running a parents group, I need to let them know that this is going to happen. If you're not happy about it, these are the ways you can let people know who's making the decisions that this is not a good way to go about it. So as you remember, in the early days, we actually had to do a lot of education of our families, and we also helped them to figure out how to get their voice heard, both in terms of our department's commission hearing, at the board supervisor meetings, and if necessary, to go to the state and help to really advocate for needing resources. So from that vantage, you could actually influence the decision that's made, and sometimes sometimes can reverse, what's recommended. And same thing when you actually are at the level of the administration on the county level, you educate the providers and you talk about the impact. Early on, you actually get people together and you say, well, you try to create more of a process, a collaborative process of trying to figure out, well, how can we reduce? But as it is, as you know, through the years, there's really not much you can reduce after, 3 or 4 years. There's really no fat to cut. So then you have to really figure out, well, given that we can't really come up with, 10%, 20%, 25% cut as required, what can you do? What can you do? So you start actually also again educating and letting people know and really have to talk about the impact and let the voice of the consumers and people impacted be heard on a higher level. So there's a lot of way you can influence. So that's one thing I have to deal with: budget reduction, lack of resource. Of course, the other big thing has to do with managing personnel, which is a major challenge in any of our. I think you talk to as many social workers in roles of supervision or in terms of management, you will hear as many stories about personnel challenges and it comes with what we have to do, and you really have to figure out how to work with it early on. And I think the lessons there is again to really understand there's often no one right or wrong answer immediately. I mean, aside from some of the egregious behavior, a lot of things that's happening are in the gray area. So you really do have to really have people be able to talk more objectively and get outside from just being in the position. Like you have to really be able to create some relationship with the union. Like I always have relationship with the union rep all year long, not when something happens, when something comes up. Your relationship with directors of programs early on, all year long, not when something comes up. So
really taking a proactive,
really taking much more proactive to prevent and anticipate things would not go right, and try to create that relationship so you can actually work on it when you have to take care of personnel matters and stuff like that. So those are some of the more managerial type of things, and then there's other things that's difficult. Of course, we in the development of system of care, sometimes things just do not work out. I mean, I remember one time I went to put an intake unit in our local detention center. And I work on it and I work on it. And I got consultant, people from Washington, people from other places, other department judges, people come in and helping to try to create this. Didn't work out. Didn't work out. So I had to wait. I mean, I had to, I did as best as I can, but then I have to wait for a change of leadership in other departments so I can actually do it. And it happened, but it was a little bit later.
I see.
Yes, a little bit later, yeah. So, yeah.
Okay. So, in terms of today, what in your what is your view about the issues that we should be addressing today? You know, what do you think we should be doing?
Well, I think we have to. I don't quite know how to do it, but I know what needs to be done. I think, in some sense, we really have to figure out how to create our next generation and the next generation of activists. Because, like I was saying earlier, in the 70s, there's a lot. It seems that there's a lot more people who care about whether we live in a robust community, whether there's people who actually are not, getting their needs met, and whether my neighbor is actually healthy and thriving, and the neighbor's kids are going to school and blah blah blah. There seems to be less of that sense of community and getting off your couch and getting off your behind and getting up and talk to the next person and say, how can I help you? Talking to the next person that actually is source provider and say, how can we actually put our head together and create some change, create coalition, and that whole idea about social activism and the call to action to address injustice seems to be kind of somewhat, I would say, lacking, and maybe it's just my age, I don't know. I mean, it just seems to be that need to be some fire that need to be fanned some more. Because I remember when we developed the Wu-Yi project, when we, you and me and some of the other social workers in Chinatown actually got together and say, well, hey, we're parents who need to get childcare so that they can actually go to work and come to mental health therapy. We had parents who actually work with us on the weekends, in the evenings, and coming to I don't know how many meetings, creating a nonprofit to actually get a childcare program started, get a childcare resource and referral center started, got an advocacy organization started, all not for their own kids.
Right.
I mean, these parents actually, we had about, I would say 20 parents who's pretty active, who work and work and work with us. And of course, our kids won't benefit from it. They from beginning to, I would say they stayed with the cause for about 10 years.
Right.
Yeah, right. I mean, and there's a robust program now, it's still going on 40 years later. But they did not benefit a bit from it. Their own kids never benefited. So how can we create that sense of, it's really great. They felt great. We felt great. And people continue to benefit from it. But where we can find that call to action, where we can find that sense of, gee, we can put our head together and gee, we can actually create a coalition to bring some betterment to the community. So I think that to me is an important thing to actually
sort of rekindling the passion in people to action, to do action.
Exactly. So that's one thing. And then I think, the other thing is actually something that is dear to my heart is really the whole reform for the public services. Public service don't have very good rep, among a lot of people. And I spent most of my career working for a public sector, public system. And I really am quite proud of it because I think it's really a place where you really hold a very responsible place where you have to really be accountable for effective and efficient use of public dollars. I mean, that really rests with public service providers. And it's a very important positions. And I think, it needs to be held much more accountable much more transparent, and much more in a leadership role in terms of social change, in terms of social policies, and in terms of creating that conduit of communication between clients that we serve to policymakers. To actually, it's a very crucial role. So I think unfortunately, I see a lot of really public sectors being mired in trying to deal with budget reduction, trying to deal with it seems that there's endless bureaucracies, and we don't get to that piece of that really good government that can actually work with good policies and good programs, for people and work together with people. So I think that's the other thing. And then I think the third area has to do with actually accountability. Again, we're in an age where we do have consumers who are much better educated, with thanks to the internet, thanks to all these proliferation of information, through the net, and people are much more savvy about what they're asking in terms of from service providers. They are much more educated when they come for services, and they demand more. And I think as service providers, we have to actually start looking at, well, what are we actually providing? How can we actually tell people why we are offering these services instead of the other services, and for how much, and for how long, and for what kind of kinds? How do you know that will work? So this whole idea about really trying to invest in either learning more from the lab, from the science, and introduce more evidence-based kind of services, or invest in really more vigilant collection of data from practices, so we can actually inform the next group of people, so we have more practice-informed kind of evidence. So either EBP or BEB, those are really needed to be articulated much more and spell out much more. And then we have to continue to have a feedback loop for quality improvement as the customer come in to see us, as the consumer comes in to see us, that we'll be able to actually take a look and see what we're offering and see whether we're helping them, and then be able to improve on it. Do more if you're helping them, do less, or don't do the same thing if you're not helping. And I know it sounds tough, but we're now going into an era where customer are asked to be providing feedback every time. I mean, if you go see your doctor, every time you get a satisfaction survey in the mail, that you get what you want. And I think it's going to come to mental health pretty soon. I mean, it's not there now, but soon. So I think that's another area that we need to pay a lot more attention, is really to figure out how to be much more articulate and much more intentional in terms of our approach, our outcome, and also our quality improvement kind of feedback loop. So that those are to me are an important thing. And then lastly, I hope we have some time. Lastly, cultural competency. I think it's really, really crucial to pay beyond lip service, to really understand cultural competency in terms of service, because the more you actually understand how the experience of clients and providers, the more you realize so much of what we do and how we actually deliver service and receive services are really kind of influenced. It has to be in the context of who we are and where we come from. I mean, it's
because oftentimes cultural competence is, it's sort of like a buzzword these days.
It really is.
And so
it really
what
is,
you're saying is that we really need to take a look at it seriously.
Exactly. And we cannot actually take the approach of, well, there's so many cultures, how are we going to actually address it? It overwhelms. It overwhelms the system. We can't deal with it. I think that's really the wrong answer, the wrong approach, because just as you try to really learn and understand and be much more specialized, I mean, we never tell someone who come to see us, who, let's say who have a headache, you never say, well, there's too many people with headaches. They all have different reasons. And I'm not going to actually try to find out why you have the headache. I'm going to give you this treatment no matter what. It doesn't work. It doesn't work. So we have to be much more, the other thing is, prescription medication, we're trying to find out, different cultural groups, different ethnicity respond to different medications differently.
Right.
So, and we don't see the medical world saying, well, forget it, we're not going to try to understand. No, we have to learn more, and we have to really kind of document more, and we have to really kind of be better provider.
Sure.
Yeah.
Yes.
We may not be there yet, but we
Right,
have to
right.
understand it as a challenge and as a charge
right,
to us
right.
as providers. We cannot brush it aside.
And constantly strive to.
Exactly,
Yeah.
exactly. Yeah, yeah. So, yeah.
Thank you.
Yeah.
And again, this is something maybe you already addressed, but in all of your experiences, what would you say was the most satisfying?
I think being able to, it's so hard, it comes back to people. But I guess that if you really have to come back to the highlight, I would have to say really being able to learn from the consumers. I mean, the whole consumer movement really opened my eye to a world that I have no idea about. I mean, when we actually started, I don't know whether you remember, we introduced the youth choose their therapist form.
Yes.
For the youth who came in. And that's
that.
an idea that came from our youth group,
Yes,
right? Our youth advisory committee said, well, you never asked us who we want to see. So we actually, created a form. We said, well, you can tell us what you want to in terms of your therapist. We may not be able to offer it to you every time, but at least we want to listen. That created such a goodwill in terms of opening a door so that, we are seeing, actually, we were always saying it's so hard to have young people come to treatment, right? They would come for one or two times, coerced into coming and never come again. But with this, asking them and having them tell us what they would like to see in terms of gender, in terms of training, in terms of, specialization, it opened such an entirely different world for us. And that really helped with that whole engagement process, right? I mean, in terms of that's just a simple idea of, just asking, the clients. And then the whole, the working with the parents group and the parents telling me about all these things that I assume really, really to be working. But all these things that seem, it's amazing. We, as system people, we think that we're doing such great job, and we have all these services, and we have all these things. That how in the world would people not be getting service? And then, but every single one of them start telling me stories about how it doesn't really meet their needs. Everybody's needs are unique, and they have unique challenges. So for a parent who is trying to shuttle, a group of their own kids and foster kids to 10 different appointments in a day, it's impossible. But when we each sit in our own chair and require them to meet this requirement, you have to do this and this and this and this in order to get off our caseload in terms of, and we can dismiss the case in front of the judge. And then you have another person telling them, you have to do this and this and this, and then you have to do this. It's impossible.
Yeah, it's quite overwhelming.
When they show you the schedule that they have, a parent, sometimes a grandparent, the schedule they have to keep, it's impossible. Sure. So it's things like that. Having that direct kind of contact with the clients and really listening and really figuring out how to actually use the feedback to change the system. I think one of the best thing I did is actually give them a seat on my my management team. I had our parent team have a spot on my management team, and that changed the rest of my management. And, prior to that, before having the parent there, often the solution, there's a lot of, it's not intentional, but often is unintentionally, the solution often lies in what the client have to change. Or somehow so-and-so is not working hard enough. It's never the provider. It's really always almost the client, this is, in some sense, the client's fault. But in reality, when you actually have a parent being part of your management team, dialogue change all of a sudden. I mean, there's all of a sudden there's not that blaming, and in fact there's starting to be more a little bit more objectivity about thinking and trying to understand what is going on. How can we actually do better? Maybe it's not resistance, and maybe it's not just a cultural barrier. Maybe it's that we're doing the wrong way of doing our reach. Maybe we're not understanding it enough. So I think that actually opened my eye to so much. And then one last thing is actually it made me so. Well, in some sense, that's one of my regrets that I did not work in education. Then I learned so much from our youth about how the educational system is not meeting their need. That I feel that I really need to get active to do that. But that's, of course, that's another field.
That's another advocacy.
Another advocacy, yeah. So,
yeah. So, if you had to do it all over again, what would you do differently?
Mm, I don't think that much. I wish I had more time. I wish I could do everything. I felt like that. Sometimes I would like to devote more time to, more social causes. I just don't have enough time. And then I wish there's also the one thing I wish that, that at one point Washington was going to do some big effort of reinventing the government under one of the president. And it fizzled. It did not happen. And I wish there had been more support for that, because I do think that government is a very important arm of making the society better, and improving governmental services is pretty vital. So I think I wish there had been more support in that area. I think aside from that, no, I think I'm pretty happy.
Okay. Yeah. And what might be learned from your experience by people entering or currently working in the field today?
Well, I think you have to really be prepared to kind of work you behind. It's a hard job. And social work is a hard job, and you have to be willing to actually give a lot of yourself, and you have to really be passionate about really helping other people, and have a clear vision as to where you want to end up in terms of being helping other people. Have a big vision, but also I think it's important to not be discouraged or feel bogged down by lack of quick changes. I think those are two different things. I think having a big vision and having a big goal for yourself, having a clear vision, but really kind of be happy with each small step that you take towards that goal is really critical. Because I remember actually I had a dialogue with a college friend when I was in college, and she's a person with disability, and she and I were talking, and then when I said, well, I'm going to do big things. I'm going to change the world when I grow up, when I get out there, and then I'm going to do this really big things. And then she said, well, it's and I always remember even now. She said, all big things came from small steps. Everything comes from small steps. So just take really, really small strides, but work towards your goal, and then you'll be very happy. You won't be disappointed. And so I always remember what she advised me. That's really good. When you're beginning, have big goals, but take really small steps and celebrate every step when you accomplish your small steps, and tell yourself that you have more to do, but you're really at each milestone. Celebrate it. Yeah.
So always remember to celebrate the small.
Always remember
the small milestones.
Yes. And then find friends to celebrate with you. That's you don't celebrate by yourself, right? And then you then celebrate your steps, and you start building a community of people with like mind and like passion, and you'll be very happy. Yeah. So,
well, thank you. And finally, what other comments would you like to share in closing?
well, I think it's really kind of I talk about the passion, but I also think it's really important to have moral courage. I mean, I've been actually coaching some mid-level managers and supervisors now, and we've been coming up with a lot of hard problems, difficult decisions, difficult tasks. And sometimes it comes down to really kind of, I said, well, it really comes down to the part of having the moral courage to really kind of know, if you know this is the right thing to do, you need to do it. And really be able to, once you check it out and you get consultation from, your colleagues, from people, from your supervisors, and you know that's the right thing. It may be a hard thing to do, but you have to really have the courage to do it. And I don't hear people talk about it that much now, but I think it's really important to remind ourselves it's okay Not everyone has to agree with you, but if you actually know that morally that's the right thing to do, you need to do it. You need to continue to have that fire. I mean, I still have the fire, about social injustice. You need to speak up for people who have no voice. You need to actually act on behalf of people who cannot take action. And then you need to be the agent of change. And you always have to remember that you are going to be the person that make the world better and make the community better, and make the place you work better, and make your home better. You are the change agent.
Right.
So,
And that's one of the first things in social work that we learn, right? Being that change agent.
exactly.
Yes.
Yeah.
Right.
It comes back to that. Yeah.
Yeah. So thank you very much, Sai-Ling, and thank you for all the work that you've done in your long career as a social worker.
Thank
Really
you.
appreciate it.
It's my pleasure.